10 warning signs of pancreatic cancer. According to the American Cancer Society, pancreatic cancer makes up about 3% of cancer diagnoses in the United States and 7% of cancer deaths. Pancreatic cancer affects the pancreas, a crucial organ located behind the stomach. The organ's location may make this cancer harder to detect, leading to a diagnosis in advanced stages. In today's video, we will delve deeper into 10 symptoms of pancreatic cancer that may help you detect this disease early and protect your life. But what can you do to keep your pancreas healthy? Watch till the end, and we will provide you with a list of foods that can help protect your pancreas. But before we start, let's first understand the disease a little more. The pancreas plays an essential role in digestion by producing enzymes that the body needs to digest fats, carbohydrates, and proteins. The pancreas also produces two important hormones, glucagon and insulin. These hormones are responsible for controlling glucose, sugar metabolism. Insulin helps cells metabolize glucose to make energy, and glucagon helps raise glucose levels when they are too low. There are two main types of pancreatic cancer, based on the kind of cell they start in. Pancreatic adenocarcinoma. This is the most common type of pancreatic cancer. It starts in exocrine cells, which produce enzymes that aid in digestion. Pancreatic neuroendocrine tumors. This rarer type of pancreatic cancer starts in the endocrine cells, which release hormones that affect everything from mood to metabolism. Now, let's find out the symptoms of pancreatic cancer. 1. Jaundice. Obstructive jaundice is one of the most common symptoms, especially in locally advanced pancreatic cancer, which could lead to liver dysfunction and eventually failure. The 5-year overall survival rate of patients with this disease is less than 5%. But how does jaundice become a sign of this medical condition? As the tumor grows, it may press against and eventually block the bile duct. This blockade prevents bile from leaving the liver and gallbladder, causing it to accumulate. The primary component of bile, bilirubin, a yellow pigment formed from the breakdown of red blood cells, starts to build up in the bloodstream. Since the body may no longer excrete bilirubin effectively through the digestive tract, it begins to deposit in tissues, leading to the yellow discoloration of the skin and eyes known as jaundice. Moreover, chronic heavy drinking may lead to conditions like cirrhosis and chronic pancreatitis, which are risk factors for pancreatic cancer. Alcohol abuse may also directly damage liver cells, exacerbating jaundice when the cancer affects bile ducts. Jaundice, therefore, indicates that the cancer has advanced to a point where it physically impedes essential processes. This manifestation occurs in the later stages of pancreatic cancer. 2. Abdominal and back pain. This discomfort usually emerges in the intermediate or later stages of the disease, acting as a subtle alarm to an otherwise silent threat. The pancreas, nestled deep in the abdomen and cradled by the spine and stomach, becomes a battlefield where the cancer begins its quiet invasion. As pancreatic cancer develops, the growing tumor exerts increasing pressure on the surrounding organs and tissues. The stomach, intestines, and other abdominal organs find themselves in a tight embrace with the expanding tumor, leading to discomfort and pain in the abdomen. But the discomfort doesn't stop there. The tumor's strategic position near the spine allows it to exert pressure on the nerves. In the compact environment of the abdominal cavity, even a small growth may reach critical nerves, including those in the back. This results in radiating pain that may extend from the abdomen to the back, creating persistent and often debilitating discomfort. According to a 2.5-year survey, 93% of the patients reported having pain related to the diagnosis of pancreatic cancer, and 83% of those reported moderate to severe pain intensity levels. 3. Weight loss and appetite loss. Weight loss in pancreatic cancer patients is endemic, as 85% of pancreatic cancer patients meet the classic definition of cancer cachexia, a wasting syndrome characterized by weight loss, anorexia, asthenia, and anemia. The pancreas plays a vital role in digestion and the regulation of metabolism through its enzyme and hormone production. When cancer interferes with these functions, the first casualties are often the appetite and the body's ability to maintain weight. The tumor's presence may lead to the production of inflammatory substances and changes in metabolism that make the body work harder, burning calories at a rate that outpaces intake. Moreover, as the tumor grows, it may physically press against the stomach, making the sensation of fullness occur prematurely during meals. This mechanical effect, combined with metabolic alterations, may significantly reduce one's desire to eat, contributing further to weight loss. Apart from that, pancreatic cancer is more common in individuals with diabetes. Due to the body's inability to use glucose for energy properly due to diabetes, pancreatic cancer can also affect appetite and cause weight loss. 4. Digestive problems. The pancreas is a workhorse in the digestive process, secreting enzymes that are essential for breaking down fats, proteins, and carbohydrates in the intestines. When pancreatic cancer develops, the ability of the pancreas to produce and secrete these enzymes is impaired, leading to malabsorption and digestive discomfort. Additionally, the tumor might exert pressure on the stomach and duodenum, the first part of the small intestine, further complicating the digestive process. This pressure may slow the movement of food, causing a backlog that manifests as nausea, vomiting, or a feeling of fullness after eating only a small amount of food. In some cases, the cancerous growth may affect the liver's function or obstruct the bile duct, leading to difficulties in digesting fat due to a lack of bile, a fluid that helps break down fats and eliminate waste products from the body. This scenario exacerbates malabsorption and contributes to the spectrum of digestive issues experienced. According to a study involving 16 patients with locally advanced pancreatic cancer, they have a severely impaired nutritional status, most likely as a result of malabsorption due to exocrine pancreatic insufficiency, a condition in which your small intestine can't digest food completely because of problems with digestive enzymes from your pancreas. 5. New-onset diabetes. At the heart of this connection is the pancreas' dual role in digestion and hormone regulation, particularly through the secretion of insulin, a hormone critical for controlling blood sugar levels. The pancreas obstructs the pathways that allow insulin to be effectively distributed throughout the body. This disruption in insulin production or distribution causes a rise in blood glucose levels, a condition known as hyperglycemia. Furthermore, pancreatic cancer may lead to the production of substances that interfere with the body's response to insulin, a phenomenon known as insulin resistance. Even if insulin levels are normal, the body's cells cannot use it effectively, exacerbating the problem of high blood sugar. One study revealed that the prevalence of diabetes among patients with pancreatic cancer was 38%. Monitoring body weight is essential, as obesity increases the risk of developing type 2 diabetes and pancreatic cancer. Excess fatty tissue influences insulin resistance, which may lead to new-onset diabetes as the cancer impairs the pancreas's ability to produce insulin. 6. Blood clots. The connection between pancreatic cancer and venous thrombosis, a condition where a blood clot forms in a vein, has been discussed for almost 150 years. Cancer, particularly pancreatic cancer, activates the body's clotting system in several ways. Cancer cells produce procoagulant substances, which directly increase the tendency of the blood to clot. These substances may alter the normal balance between clotting and anticoagulation in the blood, tipping the scales toward a prothrombotic state. In the case of pancreatic cancer, the tumor's location and its interaction with nearby blood vessels further exacerbate this tendency, making the venous blood flow slower and more prone to clotting. Blood clots in pancreatic cancer patients may manifest in various ways, from deep vein thrombosis in the legs, causing swelling and pain, to more dangerous conditions like pulmonary embolism, where a clot breaks off and travels to the lungs, posing life-threatening complications. People should monitor their cigarette consumption. Smoking is a significant risk factor for pancreatic cancer and promotes clot formation by damaging the lining of blood vessels and increasing blood thickness, thereby increasing the risk of thrombosis associated with cancer. 7. Fatty tissue abnormalities. Fatty pancreas is defined as a significant fatty infiltration of the pancreatic parenchyma and has been associated with an increasing risk of pancreatic cancer. The prevalence of fatty pancreas varies across the studies from 11% to 35%. But you may wonder how this fat deposition occurs. The pancreas plays a crucial role in the body's digestion and absorption of nutrients, especially fats, through the production of digestive enzymes. Pancreatic cancer interferes with the pancreas's ability to produce or secrete these enzymes into the digestive tract, resulting in decreased efficiency in fat digestion. The mechanism behind the development of fatty pancreas involves the imbalance between the intake and consumption of fats, leading to fat deposition in non-adipose tissues, including the pancreas. Moreover, fat accumulation in the pancreas may lead to inflammation pancreatitis. Chronic pancreatitis is a known risk factor for pancreatic cancer. The inflammation that the fatty pancreas causes due to its association with cellular damage and DNA mutations may foster cancer growth. 8. Itchy skin. This symptom may manifest at various stages of the disease, but is particularly associated with the development of jaundice, which typically indicates more advanced cancer. When a tumor in the pancreas grows large enough, it may obstruct the bile duct, disrupting the normal flow of bile and causing bile and bilirubin to accumulate in the liver and spill over into the bloodstream. Elevated levels of bilirubin in the blood lead to jaundice, characterized by the yellowing of the skin and eyes. This buildup of bile acids in the bloodstream eventually deposits in the skin, causing severe itching, medically known as pruritus. 9. Enlarged gallbladder or liver. The pancreas and the gallbladder share a close relationship through the biliary system. When a tumor develops in the pancreas, particularly in the head of the pancreas, which is nearest to the bile duct, it may grow to a size that presses against this duct, blocking the flow of bile. This blockage is where the journey to an enlarged gallbladder begins. Unable to flow to the small intestine, bile accumulates in the gallbladder, causing it to swell, a condition known as Courvoisier's sign. Similarly, the obstruction of bile flow affects the liver. With nowhere for the bile to go, it begins to back up into the liver, leading to an accumulation of bile within the liver tissue. This may cause the liver to become enlarged and tender, a condition known as hepatomegaly, which may contribute to further complications. Moreover, viral hepatitis may increase the risk of liver cancer and has been associated with a higher risk of pancreatic cancer. The effects of a tumor on the liver and gallbladder can exacerbate these infections, which can result in liver inflammation and scarring. In a study with 36 patients, 92% of patients with pancreatic head carcinoma showed at least one gallbladder abnormality, including an enlarged gallbladder and increased liver parenchymal enhancement adjacent to the gallbladder. 10. Change in stool and urine color. Conditions that predispose to bile duct obstructions, like gallstones or previous bile duct surgery, may increase the risk of pancreatic cancer. These conditions, combined with a tumor's pressure on the bile duct, lead to changes in stool and urine color due to disrupted bile flow. Bilirubin cannot enter the digestive tract normally when a pancreatic tumor is obstructing the flow of bile. Instead, it builds up in the bloodstream and eventually passes through the kidneys and excretes in the urine, turning it dark or tea-colored. Moreover, bile is what gives stool its characteristic brown color. Without it, stools may become pale gray or clay-colored. This lack of color is due to the undigested fats and the absence of bilirubin in the stool, which indicates that bile is not reaching the intestines. Furthermore, research has found that people with pancreatic ductal adenocarcinoma, a type of pancreatic cancer, have much lower levels of calcium and magnesium in their urine, but higher levels of copper and zinc compared to healthy individuals. Although it doesn't play any role in changing urine color, it shows how the body is handling these metals. Now let's talk about 5 foods you should eat that protect your pancreas. Maintaining the health of your pancreas is crucial for digestion and blood sugar regulation. Including certain foods in your diet may help protect your pancreas and reduce the risk of pancreatitis and pancreatic cancer. 1. Leafy green vegetables such as spinach, kale, and Swiss chard. These vegetables are rich in vitamins, minerals, and antioxidants, which may help reduce inflammation in the body, including the pancreas. 2. Berries like blueberries, strawberries, and raspberries. Berries are packed with antioxidants, particularly vitamin C and flavonoids, which help protect the pancreas by neutralizing harmful free radicals. 3. Whole grains such as brown rice, quinoa, and whole wheat. Whole grains are high in dietary fiber, which may help regulate blood sugar levels by slowing down the absorption of sugar in the bloodstream. This reduces the workload on the pancreas to produce insulin, helping to maintain its health and function. 4. Turmeric. This spice contains curcumin, a compound known for its anti-inflammatory and antioxidant properties. Curcumin may help inhibit the growth of pancreatic cancer cells. 5. Nuts and seeds, including almonds, walnuts, and chia seeds. Rich in healthy fats, vitamins, and minerals, nuts and seeds may help reduce inflammation in the pancreas. They also contain magnesium, which is beneficial for pancreatic health and helps with the metabolism of carbohydrates, reducing stress on the pancreas. Early detection of pancreatic cancer may significantly impact treatment outcomes. If you or someone you know is experiencing one or more of these symptoms, it's crucial to consult a healthcare professional for a thorough evaluation. While these symptoms may be associated with many different conditions, early investigation and diagnosis are key to managing health effectively. In today's video, we learned about all the signs that you may experience if you have developed pancreatic cancer, along with some amazing fruits that may help you protect your pancreas. However, do you know that there are symptoms that call for more attention to your diet? Want to find out more? Watch 19 warning signs you need to start drinking more water. Or watch, don't ignore these 10 red flag signs of a nutrient deficiency. You may watch either or both of them. Do you know of any other symptoms of pancreatic cancer that were not mentioned earlier? Let us know in the comments section below.